Good evening, and welcome to the April edition of the Mary and Pat Show, where we talk about Medicaid and CHIP. I know that you have been waiting on this day and you have some great questions for us on today. I am Sharonda Lee. I'm a technology assistant for Oak Hill Regional CDC, as well as a certified navigator. Once again, welcome. We do ask that you please like and share. Please like and share. Share with your family. Let them know that we are on and we are here to answer any questions that you may have. If we can't answer it today, we're going to get you an answer. Like I said, if not tonight, later. Now, before we dive in, we do want to give a great big shout out to our amazing team behind the scene that ensure that we are on here monthly, the last month, the last Monday of the month. Our amazing executive director, Mr. Michael O'Miter, and our beautiful program director, Sister Lottie Miner. We cannot do this without you all. A great team. We do have a great show for you on tonight. Again, remember, we're not just on Zoom, we're also live from our Healthy Kids Mississippi Facebook page as well as YouTube. So please tune in. Again, invite your family and your friends to join us each and every Monday. All right, Mary and Pat, we ready?
Yes, I'm ready.
All right, it's in your hands.
Okay, thank you. Thank you so much. Um, Hi, my name is Mary Fenner, and I'm a Medicaid application administrator with Oak Hill. Also, I'm a certified navigator as well. Pat is not on tonight, so it's just me. And if anyone have any questions they would like to ask, they can just submit the questions either on Facebook. We have somebody that's monitoring Facebook with questions, or you can send them to Facebook. That's it. Okay, so I do have some questions that have been sent in earlier. And the first question I have is, I heard something about presumptive Medicaid. Can you tell me what that is? Well, presumptive Medicaid is eligibility for pregnant women, allows them to get qualified providers to immediately deem pregnant women eligible for limited Medicaid benefits for a temporary period while their Medicaid is being approved or the application's being processed. So you can get, once you submit your due date, let them know that you are pregnant. Then you can actually get services dealing with your pregnancy prior to your actual, while your application is being processed. So you will have like only the qualified providers are the OBGYNs, the primary care providers, federally qualified health centers, rural health clinics, the Mississippi Department of Health employees can make presumptive eligibility determination. This coverage is limited. It's a limited Medicaid benefits. They are limited and focusing on prenatal care. So it's only for prenatal care only. You do have to submit a Medicaid application into your Medicaid office. And by the end of the second month of presumptive eligibility coverage, though, you need to have your application in so that they can go and approve you for Medicaid. Okay. Oh, I have another question. How long does it take to get approved for Medicaid in Mississippi once the application has been submitted? Well, it takes approximately 45 to 90 days, depending on the type of Medicaid application that you have submitted. Usually, if it's for children, it may take about 30 days, but if it's dealing with Medicaid disability, if you're applying for Medicaid disability, it may take a little bit longer, sometimes up to 6 months. But you can check with your um, Medicaid person to see if you have questions, if you need to know, if you need to submit any additional information, you could check with them to see how far along they are going on with your application. Also, we can sort of help with that too. If you have any questions about your application, if it has been approved or if it's still in the approval process, if you need to submit additional information, we may be able to contact the Medicaid office to check on your applications as well. And all you have to do is give us a call, 662-298-3584, so that we can further assist you with your Medicaid application. Okay, then our next question is, how soon can I start using my child's Medicaid after I submit my Medicaid application? You can do it as soon as you receive your approval letter, letting you know when the Medicaid will start. And that's when you can, once you get your approval date, then you can use it right then and there. Usually it's Mississippi Medicaid usually starts the first of the month. So it would be November 1st or December 1st when it'll be available for you. It always starts on the first of the month. So once you get your letter and once you get your approval letter, you will have your Medicaid ID number on there. Once you get your Medicaid ID number, you can make your appointments with your doctor for your children or for yourself. But don't forget, you have to be renewed every year. A year from the date that you actually started getting your Medicaid. So, if your Medicaid started April 1st, 2025, look for a renewal letter around April, probably the month before March on 2026, because you have to be renewed annually. Sometimes they can do automatic renewals. They will send you a renewal letter. Sometimes you just have to sign it and send it back to them if they can get the information that they need. But you will get a letter. So watch out for that letter from Medicaid. Okay, we have another question. I need to apply for Medicaid for my children. I had to take one to the doctor last month and had to pay out of pocket because the kids' Medicaid had been closed and I didn't know it. Will Medicaid go back and pick that month up, and can I get reimbursed? Well, Medicaid does allow for rective act. When you do the application, you can put down that you want to apply for retroactive Medicaid, but it can go up to 3 months prior to the date of your application. But if your child falls into the CHIP category, CHIP does not do retroactive. And in order to get reimbursed, you need to call the main Medicaid office to see if you can get reimbursed for the money that you had spent on Medicare. But they will go back as long as it's regular Medicaid, and CHIP does not do retroactive Medicaid. Okay. Is Mr. Campbell on now?
Yes, I am on.
Okay.
All right, so but what I'd like to talk about just a little bit is qualifying for coverage through the Affordable Care Act. And right now, open enrollment has ended. Open enrollment ended January 15th. But that doesn't mean that you're not still able to possibly qualify for what's known as a special enrollment period. And to qualify for a special enrollment period, an SEP, you generally need to have a qualifying life event that triggers an exception to the regular open enrollment period. And these are such things like losing coverage, getting married, having a baby, moving to a new area. If you move to new zip code because your coverage is based off of your particular zip code that you reside in. Moving to a new zip code could possibly qualify you for special enrollment period. If you have a new job, that can qualify you for a special enrollment period. Then also sometimes if you have a significant change in your income, for example, your income may at one time may have been too low to qualify for ACA based off your family size. If you've had an increase in your income that takes you above that threshold, then that would also qualify you for a special enrollment period, and should be able to apply for coverage. And then there's also currently still what's called the low income SEP. The low income SEP is for people or households whose income is below 150% of the federal poverty level for that particular family size. And so if you don't have coverage, that might be one way that you could be able to qualify. And then there are other circumstances that might apply to you as well. So right now, I think the best thing I can tell you is if you don't have ACA coverage, you don't have job-sponsored coverage, you don't have coverage through an employer or through another family member, then you can give us a call at our famous number, 662-298-3584, and we'll get you in touch with a navigator. And this navigator can collect the appropriate information, submit an application, and see if you indeed do qualify for a special enrollment period. So we don't want to give instances when you may not qualify and tell you we don't think you'll qualify. What we want to do is try every means possible to try to get you qualified. So if you don't have coverage, give us a call and we'll do what we can do within the regulations of the Affordable Care Act to see if we can get you your family insurance. Okay, and that's about all that I would have for this evening.
Okay, thank you, Mr. Campbell.
You're welcome.
Okay, now I do have another question. I am not working right now and I have no household income. My parents help me with my living expenses until I get a job. I also get help from my children's dad. Since their dad helps me, do I still have to cooperate with child support? And the answer is yes, you do. You still have to cooperate with child support, even if the children's father are helping you, you still need to cooperate with child support in order for you to be eligible as the parent for Medicaid. Now, the children will still be eligible, whether he helps or not, whether you cooperate with child support or not. The children are eligible, but you as a parent, you do have to cooperate with child support. One other thing, if you applied before and did not cooperate with child support, but now you want to, you have to contact child support and let them know that you're willing to cooperate with them. And they can also put it on the in their system that you're not cooperating with child support. So you do have to let them know. If you do not let them know when you apply for Medicaid for yourself, you're not going to be eligible. You're going to get denied for not cooperating with child support. So you do have to have an open communication with the child support office to let them know that now you're willing to cooperate with them. Okay. Okay, when I receive my Medicaid cards, I have already received the approval letter for the children with their numbers. But the question is, when will I receive my Medicaid cards? She already got the approval letter, but with the Medicaid ID numbers on them, but she has not received the cards. Well, it is sometimes when you get Medicaid, they may not send the cards out right away. Also, if you've gotten Medicaid in the past and you reapplying after your Medicaid has been closed or denied for you or your children, they may not send you a new Medicaid card. So therefore, you have to contact the office, but you have the approval letter with the Medicaid ID numbers on there, and you can use those to go to the doctor. So, but you do need to contact the main Medicaid office in Jackson, and their number is 1-800-421-2408 to request a new card. Okay, so I do have a question that has come through, and it says, can you have both CHIP and Medicaid? No, one person cannot have CHIP and Medicaid, but you may have children in your household that one child may have CHIP and another child may have Medicaid. It depends on the income. They would, and who's ever filing taxes on that child. So say for instance, the father is filing taxes on the child and you're working too. Well, what they would do is take both incomes for that particular, to cover that particular child. So that may put that child in a higher income level, which may, that child may end up being on CHIP. But the other child, if the parent, one parent is only filing, or there's only one parent connected with the child, then they will only use that one parent income. So that child may end up being just on Medicaid. But they do pull tax records. Those incomes are counted from tax records. So whatever income is showing, if that child is being on taxes with somebody else, if that child is in your household, then both incomes are going to be counted toward that child. So that child may end up on CHIP. Then you may have another child where the father's actually not in the household, or the father is not around the child or claiming the child, then that child may end up on Medicaid. And there's another question. Is there a limit on the number of persons in a household that can be eligible? There is no limit on people being eligible for Medicaid. There's no limit of, they just have to be eligible. You know, people, some parents may have over 5 kids, well, all the kids, whoever you apply for, regardless of how many children are in your household, they're eligible for Medicaid. It still goes on your income. It's still based on income. I have another question that said, what does CHIP not cover? Well, CHIP, the only thing CHIP does not cover, which CHIP stands for Children's Health Insurance Program, is braces. If your child needs braces, CHIP does not cover braces, but regular Medicaid does. So, but if you have a child that's on CHIP, they're not able to get braces through the Medicaid system because their CHIP does not pay for Medicaid. I mean, does not pay for braces. But if your child is on regular Medicaid, then Medicaid does pay for braces. Okay, I have another question. I took my son to the doctor and they told me that they do not take Medicaid. Why is this? Well, Medicaid has health providers, and that particular doctor's office may not take that particular provider that you have. It's Magnolia, it's Molina, or some of the health providers that Medicaid has. So usually what you need to do is check with a doctor's office to see which provider that they do take. Because Medicaid runs just like regular health insurance, because basically that's what it is, health insurance. And you know, with health insurance, some doctor's office do not take certain health insurance. So, and that's the same way Medicaid is. Some doctor's office may not take that particular Medicaid. So with that has that particular provider. In some cases, if you pick a provider, they may have a certain amount of time that you can change providers. But if you've been with that provider for a year, the only time you can change providers is when it's time for your annual renewal. Then you can change providers and pick another provider. But the best thing to do, check with your doctor's office if you get ready to change providers and see which provider that they accept. Because some offices do not take all of the Medicaid providers. And okay, I see another question. Can you make too much for Medicaid? Yes, you can. You can make too much for Medicaid. And if your income limit is too high for Medicaid, you may fall into the CHIP category. And then the child may be eligible for CHIP. And it takes the same amount of time for CHIP to get approved as Medicaid, usually 30 to 45 days if it's regular Medicaid or CHIP. The only time it might be longer if you're applying for disability for that child, it may take a little bit longer than 45 days. It may take all the way up to a month. And I have a question. Mr. Campbell, you have a question?
No, I don't have a question, but when you were speaking about making too much money for Medicaid, it folds right into some information I wanted to add about Medicaid recipients that are going through the redetermination process, annual redetermination. If when you go through redetermination, if it's determined that you no longer qualify for Medicaid, if your child no longer qualifies for Medicaid, or if you're the mother and you no longer qualify for Medicaid due to possibly, again, the child turning 19, or maybe now the income is too high to qualify for either Medicaid or CHIP, then that's another situation where you will qualify for Affordable Care Act coverage. And in fact, there's a program going on right now where a lot of Medicaid recipients are going to be contacted, those that it's been determined have aging out or losing Medicaid coverage because of one of these factors. We'll just call it MAC, MAC representatives will contact you to let you know that there is coverage available through the ACA. There's coverage possibly available through the ACA. And so people that find themselves in that situation, these calls from MAC are legitimate calls, and quite possibly you could also get a call from another navigator that's been given this referral to see if you're interested in qualifying for ACA coverage. Okay, I think that's it.
Okay, thank you.
Welcome.
Okay, another question that I have received. What does Medicaid cover? Well, Medicaid covers office visits, wellness visits, and care, family planning services for those who qualify, inpatient and outpatient hospitalization and care, prescription drugs, vision and dental visits, eyeglasses, psychiatric care, and also transportation. There's a number that you will have to call if you need transportation. It's 844-525-3085. And they will provide you with, that's if you're on United Healthcare, you will call that number. But the thing, United Healthcare is, I think they're the one that's leaving, that they're no longer going to be a part of Medicaid. It's Magnolia, is Molina. And there is a new one. That's starting July 1st. And if you need some additional information about that particular, you can call your Medicaid office and they will provide you the information with that particular provider. Now, if you fill out a new application or a renewal application for Medicaid and you do not pick a provider, they will provide one for you. And with this new provider coming on effective July the 1st, you may end up being with that particular new provider. So if you have a certain provider that you want, then you need to specify that that's the provider that you need, that you are interested in. Because most of y'all's providers do the same thing, though. They do the same thing. It's just that the doctor's office is the one that decides which provider that they would take. So if you if you fill out a new application or renewal, and if you receive information about a provider that you had never been to before, you need to contact your doctor's office to see if they take that provider, that particular provider. Then you can, if your doctor's office does not take it, then you can request, if it's a new application or in the beginning of your application or beginning of the renewal within a month or so, you can request to switch providers, but it's a short amount of time that you can switch providers. So that's something that you need to get on right away in order for you to switch providers. Now, someone asked the question, what's the difference between Medicaid and Medicare? Well, Medicaid is a federal program that's ran by whatever particular state that you live in. So it's federally provided, but it's state ran. So each state has their own methods or the way of how they run Medicaid. So whatever state you're living in, you have to apply for Medicaid with that particular state. And Medicaid, they have different types of Medicaid, not only for children, but they have Medicaid for adults, disability Medicaid. Well, Mississippi does not have a program for people aged 19 to 64. So if a child turns 19, that's what Mr. Campbell was talking about earlier. If a person or child turns 19, he's no longer eligible for Medicaid. And we do have other, like he can apply for health insurance through the Affordable Care Act. Now, Medicare is a program that's federally funded, and it covers adults 65 and older, and some under 65 if they have certain medical conditions that they need to get covered with Medicare. So Medicare is something entirely different. Medicaid you have to apply for. Medicare is something once you turn 65 or close to it, like a month before, you start receiving information from Medicare, letting them know that once you turn 65, you're going to be on Medicare. Medicare is a program that costs. You do have to pay for Medicare. And well, we know Medicaid is free. Medicaid covers all prescriptions and doctor visits. What Medicare does not. Medicare pays only 80% of the doctor's visits or the hospitalizations, and you're responsible for the 20%. Some places or some people can get help with the 20% because there are other programs out there that they may be eligible for to get help with the 20%. I know some people that are retired and they still keep their Blue Cross Blue Shield. Then Blue Cross Blue Shield will pay that 20%. But there are also other programs like those Medicare Part C, where they will also may cover that 20% for you as well. You also can apply for Medicaid to see if they'll be eligible to cover your 20%. Also, Medicare charges they have a fee that they charge every month that everybody's responsible once you turn 65. Some people can apply for Medicaid, Mississippi Medicaid, to see if they'll cover their fee. If you're eligible, then Medicaid will pay that fee, whatever. It's like 185 now that that Social Security. If you get Social Security, it's going to automatically come out of your check. If you don't get Social Security, you will get a letter from Medicare stating that here, now you're responsible for this money to come out your Medicare insurance program. And the other provider that's starting July 1st with Medicaid is called TrueCare. Thank you, Mr. Campbell. It's called TrueCare. That's the name of the new Mississippi Can provider. So it's Molina, Magnolia, and TrueCare. So if you're getting Medicaid or if you're about to renew your Medicaid, you need to check with your doctors to see if they take TrueCare. But it's not effective till July the 1st. And I have one other question. I have 2 children and one of them is on SSI. Will my SSI child interfere with the other child getting Medicaid? And no, it will not. SSI does not count as income toward your child's or toward Medicaid. SSI is one of the things that are not counted for Medicaid. Also, child support. If you receive child support is not counted as income toward you getting or your child getting Medicaid. So SSI is not counted. Child support is not counted as well. And somebody asked, do we charge for helping a person fill out a Medicaid application? Oak Hill does not charge. It's a free service for you. If you need assistance with applying for Medicaid, if you need assistance with renewing your Medicaid, all you have to do is contact us. With your permission, we will put a Medicaid application in for you. Also, any requested information that they may need, like if you need to submit your income, we also will submit that for you as well. Just contact us, 662-298-3584, and let the person that answers knows that you're interested in applying for Medicaid or you want to do a renewal for Medicaid, and she will get you to the right person. We have sisters all over the state of Mississippi that are ready and willing to help with assisting you with Medicaid. So if you need to see somebody in person, we have somebody that you can see in person as well. So we are here to help with all matters of health insurance, not only Medicaid, not only CHIP, but also ACA. We also do referrals to the federally qualified health centers. We also have people on staff here that will help you if you might need some information about prescriptions, things like that. So any type of information you might need dealing with health insurance, contact us and we can see if we can help you. If we can't help you, we'll try our best to find somebody else that will be able to help. I have another question. Does it matter which area or region you live in as to which Medicaid insurer will cover, or is it throughout with no limit? There's no certain region. Whatever provider, they will assign you the provider. If it is like TrueCare is a new provider, and as far as we know, it's covered the whole entire state of Mississippi. But if it does not, they will not assign that particular provider to you when you apply. If that provider is not available in your area or region, the best thing to do is to check with your doctor's office to see which provider that they take, because there have been instances where they go to the doctor and the doctor does not take Magnolia or the doctor does not take Molina. Sometimes certain prescriptions are not covered by Magnolia or not covered by Molina. So you need to check on your prescriptions as well, especially if it's a child that's on diabetic medications. I know one of the providers may not pay for that particular diabetic medication. So it's best to do your homework, research. It's important that you do research regardless of what type of insurance that you have. Research and know what it is that your doctor takes and what they will take, what they will not take. Because that's very important that you know what they're covering, what they will not cover. And that's all the questions that I see right now. Are there any more questions? Miss
Mayor,
Lee?
yeah, I do have a question.
Okay.
How would the families find out who the provider is?
The way they will find out that they will get a letter from Medicaid letting them know which provider that they have. If they're renewing their Medicaid, it'll be in the approval letter. If they're applying for Medicaid for the first time, it'll be in that particular letter letting them know who their provider is. When you renew, and also when you put in application, there is a space on there that you can put down which provider you want. So if you have a doctor that you've been going to forever and you don't want to switch doctors, then what you would do was check with that doctor and see if they still take Molina, if they take Magnolia, if they take the True Care. And if that's the one, they do whichever one they take, then you put it on the application saying, I want Molina, or I want Magnolia, or I want True Care. And you have to also check with um, them to see what prescriptions they don't pay for. Because I know certain prescriptions that they do, especially if your child is on medication that he's taking on a regular basis, then you need to check with that particular provider and see if they pay for that prescription. A lot of times, a lot of people, they don't know, especially if the provider has been changed. And then when they try to get it filled, that provider doesn't pay for that particular prescription. So it's important, we all need to do research. We need to do our due diligence to find out what it is that they take. And if you need assistance from us, we can look into it for you as well to find out which prescription that particular provider pays for or won't pay for, especially if they're on a medication that's detrimental to their health that they have to take every day. Then you need to find out, does your provider pay for that prescription? Because some of that medication can run up into the hundreds of dollars. And that's important for your child survivor. One other thing I want to talk about is your address. If you have moved, please let the Medicaid office know that you have moved. Because when it comes time for the renewals, or if they send out any type of letter to your house, if that letter goes back, they would terminate your child that's on Medicaid, or yourself if you're on Medicaid, you would get terminated. They will not send another letter out stating, okay, we found out this letter came back. Like some companies do, if the letter goes back, they may try to still contact you to verify your address. Medicaid will not do that. They will not contact you. They automatically assume that once that letter comes back to that office or to the main office, or that you're not eligible, no longer eligible for Medicaid, and they will terminate you as soon as possible. So you please need to let them know if you have moved, if your phone number has moved. You also can provide them your email address, because sometimes they do contacts through email as well. Okay, I see another question. Is there a cap on the number of Medicaid visits an individual child can have per year? There is a cap on the visits. I will have to check into it to see, but you allow like a wellness visit, which wellness does not count toward a regular visit. But you are allowed so many visits a year, and I'm not sure of the number. When I was working with Medicaid, I did know how many visits that they allow, but there is a cap on the visits per calendar year. I've never known anybody to actually go over the visits, the amount of visits that they have. And if it comes to a point where you have to go and say you have reached the cap, the doctor can submit something to Medicaid to let them know that you need those many visits, but especially if your child has some type of medical condition where he has to go to the doctor on a regular basis, they need to let Medicaid know that this child needs to come every month or every other week, and then they will change it according to what that child's needs are. But other than that, there is a cap on Medicaid visits. I will have to find out how many visits that you allowed a year. I did know at one time, but that's something I would have to check into and let you know. Oh, I do not see any more questions. So anyone else have any more questions? Or are there any questions on social media? Okay, Ms. Lee.
All right, if no more questions. Oh, wow, some great information has been shared with us on today. Again, if you have questions, please, please, please contact us. You can contact us at 662-298-3584. Please contact us. We are willing to assist however we can, because we want to ensure that everybody has the health insurance and benefits that they need. I forgot to tell you earlier, we also have a free app that you can download. So if you have not already downloaded this free app, it is Oak Hill Regional CDC, and it's available on both the Google, in the Google Play Store and the Apple App Store. And again, it's absolutely free, has great information in it as well. Please download it and share with your family and friends. Once you download it, you will find that you will like it. So please do that as early as you can. Again, we have enjoyed you this evening. I can't say it enough. We're here to assist. Please call us 662-298-3584. Just want to recognize our amazing team again, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. Again, this has been an Oak Hill production. Good night.